Welcome to day 4 of CES. Woo! We made it. Amazing technology across Las Vegas. So we're here to talk about how to bring that technology to billions of older adults worldwide. So for the past couple of days here at the AgeTech Collaborative Forum from AARP, we've made the business case over and over. Older adults want to use technology. Older adults have unmet needs. Older adults want to be seen, heard, understood. They want joy and independence and agency. It is a fast-growing, yet vastly underserved and often misunderstood, growing consumer segment. So, this is the call to innovators to take your brilliant minds and incredible technology and figure out how to apply all of that to make aging easier. So, to give structure to the journey, we recognize it's complicated. And we want to surround you with the expertise and the mentorship and the guidance and the connections and the collaborative opportunities so that your idea can thrive, and so can you as an entrepreneur. So in this session, we're going to talk about a couple of innovation challenges, both US and global, to help you be the best entrepreneur and help the most people. So to get us started, it is my great pleasure to introduce Sarah Lenslock, Senior Vice President of the Brain Health Initiative at AARP. Welcome, Sarah.
Danielle, thank you very much for that warm welcome, and I'm very excited. Here we are, a Sunday morning, after many days here at CES. It's been a great conference, but I have to give a shout out to the audience for you hardy souls who are here at 10 o'clock on a Sunday morning in Vegas to listen to how can we solve the toughest challenges in aging by inspiring innovators around the world. So it's terrific. I know that we've got some great panelists coming up, and you're going to be happy you're here. So welcome, come on in. So as Danielle said, I'm Sarah Locke. I'm the Senior Vice President for Policy and Brain Health at AARP. So what the hell am I doing at a tech conference, right, if I'm talking policy? Well, one of the things we want to do is solve the toughest problems in aging. And one of the toughest problems is maintaining your brain health as you live your life. We at AARP want to reduce people's risk for cognitive decline as they age. We want to improve care for people living with dementia and their caregivers. And we want to inspire a cure for what people think is an incurable disease. So, how are we going to get innovators to join us in this challenge? Well, we got to clearly define the problem. We know that this is $350 billion are spent in the United States on providing care for people living with dementia. That's just 1 year. But people don't get diagnosed. People are suffering. And so that's not enough. The $350 billion being spent in healthcare is not enough to solve this problem. We want to create a supportive environment for innovators. So one of the things that AARP has done is joined and collaborated with others. And I want to tell you about the Longitude Prize on Dementia. So at the AgeTech Collaborative, we at AARP have partnered with the AgeTech Collaborative, AARP Policy and Brain Health, to bring a prize to innovators who can improve the quality of life for people living with dementia. Now, we have gone all over the world. Age UK and, Alzheimer's Society, Innovate UK, and Challenge Works have provided the funding, but all of these organizations have come together to support innovators, to collaborate and find and nurture the brilliant minds and the brilliant solutions that have come forward. So a key framework that you were talking about is collaboration, and so that's what we're trying to do. So it's a $5 million prize to develop technology to support people living with dementia. So I want you to check out this and apply, and it's not just one winner. $4 million is going to be awarded to the most promising solutions starting in the spring of this year. There are going to be 20 solutions that are selected and financed and then nurtured in an innovation hub. And then the final winner is going to be given another £1 million, or $1.8 million, in 2026. So here's the entry deadline is coming right around the corner, the 26th of January. 23 discovery awards at $94,000 each will be awarded in May of this year. What's interesting about this, the judging is going to be involving people living with dementia. It's going to be a co-creation opportunity so that if you've got ideas, people with dementia and their caregivers are going to help you become the focus group and make sure that whatever your solution is effective. Then there's going to be a 12-month discovery phase where the experts will help the innovators develop their projects. And 5 finalists will be given $353,000 to continue on their journey. And in February of 2026, the final winner will get a $1 million prize. And just think at the end of it, yes, the innovators will get this money, but we will have new solutions that are going to transform the experience of somebody living with dementia. So who can apply? Individuals, academic groups, companies, nonprofits, anybody with a great idea. So applicants must agree to have a high standard of data ethics. They've got to commit to co-design their solutions with people affected with dementia, and then work with all of these great folks to help make this solution work. So they've got a meet a judge and ask anything session next week. Again, the application deadline is the 26th, and we hope that that is a great example of how collaboration and offering incentives can provide the framework to make these solutions real. So, Danielle?
Awesome. Yeah, keep that for 1 second. That is so exciting and inspiring, Sarah. Thank you. We'll have you come back for a panel discussion, but I do have one quick question before we go, because I'm loving that slide with all the collaborators, both national and global, and we're talking about dementia.
Yep.
So it's clearly universal.
That's right.
Can you give us a sense of, like, was it hard to get to consensus? Like, how are the global community, like, activated around this topic?
Oh, don't get me started.
We need more than half an hour.
I really, seriously, we've been working on this since 2013. This is something that is an initiative of the G8. And so for years, we've been working to catalyze the international policy thought leaders to drive action. And what they've really been stymied about scaling solutions, right? We're getting the public involved, right? But until you capture the imagination and get solutions that are affordable, sustainable, and able to be put anywhere around the world, you're not going to solve this problem. And that's why tech is such a beautiful solution to this problem, because even though thought leaders and policymakers across the world are grappling and struggling with this issue, they know that all the money in the world thrown at a research project is not enough. So if we're going to transform care and transform people's lives, we have to do it, through cell phones and through AI and through all of these great innovations.
Awesome. Well, thank you. And thank you for giving us that insight that it's been since 2013. So this is a great idea whose time has clearly come. And here we are in 2023, kicking off 2023, a decade later. So let's talk more.
Sounds good.
Sounds amazing. Okay. So we heard yesterday from Seth and Lauren Rogan about their family journey as caregivers for her family members who suffered from dementia. And really, innovating for the caregivers is almost as important as innovating for the person who is receiving the care. And so with that, I'd love to invite Antonia Dean from Comcast, who, as an organization of its size and scale, has really, really answered the call about caregiving and innovation. And welcome, Antonia.
Thank you. I'll sit down.
Yeah, let's have a little chat. So, Antonia, first tell us about your organization, the Comcast Lift Labs. What are the goals, the strategies? Why are you doing this work?
Absolutely. So many of you all may know the name Comcast. You certainly know NBC. You certainly know Universal. So we are a major media connectivity and entertainment company. But specifically within the Comcast side, I sit on the startup engagement team. And our challenge is to be out in the market, to be at places like this, to be meeting the best, freshest, latest technology and the founders who are building those things and seeing how do we make our products and services better for our customers and how do we make ourselves a better employer because we have over 100,000 employees. So even new enterprise software solutions can actually really help the experience of the folks that we employ to have a better job.
I love that. So you're thinking on behalf of the millions and millions of customers that you have that are receivers of the content
Absolutely.
and all of that. And you're thinking about your employee base.
Absolutely.
So tell us how you structure your innovation program.
Yes. Yes. So we really structure all of our innovations focus on the needs of our business units. So we don't go out into the market, find something cool, and then bring it into the company and take it on a roadshow and try to get people excited. We start with our colleagues and we ask them, what are the pressing strategic questions that you're up against? What are the problems that are constantly things that you need to solve? Using management consulting terms, what's the classic build versus buy? We know this is the problem, how do we get to the solution? So we're starting there and asking our colleagues first, and then we have a very clear mandate of what we go to the market and seek.
So when you talk to your colleagues, how did the conversation around caregiving show up?
Absolutely. So as I mentioned, we are a major employer. We have over 100,000 employees, and we actually partnered with our employee benefits team, which we call Total Rewards. And they said to us, listen, we know care is a concern. We can't even quantify how many hours are lost because employees are dealing with care issues before they come in and they're stressed out and they're not as able to be productive, or they have to take an hour out of the day to get on the phone with mom's doctor. And so for them, they said any solution would be great here because we know this is a problem. At the height of the pandemic, we saw monthly numbers of almost 1 million women dropping out of the workforce, citing care concerns as the reason why. So we really pride ourselves. We want to be one of the best employers for everyone, but particularly for women, for people of color. And so we know our employees needed that support in their caregiving issues. So when we heard that from them, we said, great, let's go see what the market has to hold. And the care economy is an almost $650 billion market. That is the money we're spending from the moment someone is born all the way through to the end of their life. So we knew there was huge opportunity financially, but also opportunity for us to improve the experiences of our colleagues and teammates.
Well, and I love this story on so many levels because there are so many levels of value that you're exposing here, right? So there's, the HR level, right? That just the pure employee experience and productivity. We talk about presenteeism in this work, right? Employees might be present in the office, like they're sitting there at their desk, but if they're thinking about their loved one back home or they're stressed out or they have another full-time job when they get home to take care of their loved ones, we're not, nobody's winning in that scenario. I love the next level that the company is considering this as an employee benefit, right? This is not an employee point of shame. Or an employee okay, I guess you have this other concern in your life, time to go, like people dropping out. They're self-firing themselves in a way, which is really tragic. You're saying, let's flip it. Let's say we care about you. Let's turn this into a benefit, right? And now you're also exposing this as a structure for lots of other large employers. So that's awesome. So let's talk about some of the ideas that came up.
Absolutely. So we went into this thinking, and I will name my bias here. I have 2 young kids, so I was like, oh, it's going to be childcare. That's going to be where we find all the interesting innovation, all the tech solutions. And that was not it. It was elder care. It was, I have an adult in my life who I really, really care about, who relies on me, and I need a better solution to help them continue to thrive. And so we looked at solutions that were concierge solutions for the caregiver that said, hey, caregivers burn out at an incredible rate. To say, if you are stressed out, here is one person you can call who will help you navigate not only your corporate benefits, what the state offers for you and your loved one, what your loved one may be entitled to based on what they did for a living or, their veteran status. We saw technological benefits in the home. So a screen that coordinates everyone's chore list and field trips and activities. We saw technology solutions for paid caregivers that were to say, hey, you know what? If you have someone coming in to take care of your elderly father, it may not be the same person every single day. And folks were leaving Post-it notes all around the house. So we saw companies that were consolidating all of that and having one place for any caregiver to see what does this person need, what are their likes, preferences, schedules, routines. And we also saw solutions for folks that didn't necessarily need medical care, but needed companion care and general social support.
Well, and so what we're seeing is that it really is an evolution. It's an evolution as your family needs and dynamics change, and as the people that you're caring for, how their care is evolving. So it really isn't just one point solution. It's going to be a whole collection.
Absolutely. And what we really are seeing is that the founders that are creating these companies are building it off of personal experiences that they have had. Okay, my mom got hurt, and what we really needed was someone who could check in every afternoon. So I'm going to build the technological solution. The company that coordinated all the care directions, it was founded by a home health aide who said, every time I go to someone's house, there's just Post-it notes all over the place. And I'm calling and saying, what time does this medicine? They're like, look at the green Post-it in the bathroom, but then there's a blue Post-it on the refrigerator. Yeah. And that woman was a nurse and said, there's a better solution here. So I'm really excited because we have this idea of tech founders being 20-year-olds on a skateboard in a hoodie dropping out of school. And what the reality is these are people who've had full careers, full lives, who've encountered a challenge and have the experience, the know-how, the grit to actually create a new solution for everyone else.
Well, and thank you, Comcast, for normalizing the conversation. So when I entered the tech field as a woman and mom, back in the 90s, early 90s, okay, late 80s, now you can know how old I am.
That's your business.
Right? So I was one of the first generation of women entering the corporate environment, and then had babies, and then had to nurse in the bathroom because there was no such thing as nursing rooms. I mean, we were just trying to figure out how to have a career and be great moms and partners. And it became a cultural conversation to say, I'm leaving at 4:00 to go to my kid's soccer game. And it took a while for that to be a celebrated point of pride. It's very different to say, I got to leave at 4:00 to drop my, pick up my mom from dementia camp. We're still not there yet. So thank you, Comcast and Antonia and you and your team for normalizing the conversation, saying, you know what, it's okay. We're all in this together.
We're all in this together. And the one thing that I will end with is that the future of care is the true future of work. So the collaboration tools,
Tweetable.
The Zoom backgrounds, we're there. What people really need to thrive at work is they don't want to have to hide these conversations. They want to be able to say, this is why I'm leaving at 4 and I'll be back online at 7. So the employers that get supporting caregivers right are going to be the ones that get employee retention right, who get absenteeism and presenteeism right.
Love it. That is the tweetable.
Awesome.
Go.
Thank you.
The future of care is the future of work. Thank you, Antonia. Woo! Stephen. Okay, so Sarah talked about the importance of research translating into products and services that could be commercialized. And it's so hard to get the right evidence, the data, the brilliant minds together to validate your idea. But Stephen, you and your team are coming up with a way to make that happen. So take it away.
Yes, we are. The future of care is the future of work. I love that, Antonia. So thank you, Danielle. My name is Steve Liu. I'm with the let's see here.
There you
Okay.
go.
I'm with the A2 Collective, and I actually come from the tech venture world. Whoa. I actually come from the tech... Sorry about that. I actually come from the tech venture world, and when we founded the A2 Collective back in, actually about a year ago today, I have to really give a shout out to the ARP for a number of things. Number one, for Danielle and ARP for allowing us to make this presentation. But I reached out early on to the AARP Innovation Labs, Rick Robinson and Sasha Spellman. They're incredibly supportive on our new initiative funded by the NIA, which I'm going to tell you about. And the other thing I really want to give kudos out to the ARP is I think it's really about staking a claim that this is the AgeTech space. Because when I first came in last year in January of 2022, this space was kind of, is it elder care, elder tech? How do we actually categorize it? And I think that's actually so important on here. So what is A2 Collective? Originally it started as the AI tech and aging space. And we are a $65 million program that's funded by the National Institute of Aging, which is part of the NIH. And our stated goal is to spur and empower innovation in AI tech and aging. And we are funded by 3 centers or collaboratories. And the original purpose of the A2 Collective, it was actually called the Artificial Technology Collaboratories for Research in Aging. And so we shortened it to the A2 Collective. But the A2 Collective essentially stands for 3 centers that are housed at Johns Hopkins, University of Pennsylvania, and the University of Massachusetts. Of the $65 million, $40 million is dedicated to pilot projects at the intersection of AI, tech, and aging. And so think of us as the pre-seed fund to the NIH seed fund that's here. So what we're looking for, and we give out $5 to $8 million per year, up to $200,000 in direct costs. To apply, you just need to be a U.S.-based entity. And we're announcing our first 33 awardees. Actually, today. You're getting a preview of this. So we're releasing this press release on Monday, which is tomorrow. And these are the first 33. And you'll see that we have a wide variety of areas. It's anything from detecting frailty to medication management to cataracts. There's 2 aspects to the fund. We're focused on number one, healthy aging, as well as Alzheimer's disease. There's also a caregiver focus, as well as a focus on rural populations and underserved populations. And we're using a variety of, about 85% of these projects have some sort of AI or ML component that's actually in there. And we're really excited to be working with folks like the ARP. So you'll notice that one of the 33 awardees is an AARP Innovation Labs company called MindMix.
Yay!
And actually, I'm told that on our second class, there is another AARP Innovation Labs company. So I'm really hoping to deepen this relationship with the AARP and especially the AgeTech Collaborative. And so anyway, this is kind of a smattering of it. You'll see that it's a very broad aspect. And we really want to encourage everybody to apply on May 1st, 2023. It's a very short application. So even though it's still a grant that will be approved, reviewed and approved by the NIA, it's a 2-round application. You can request up to $200,000. You have to select which research collaboratory that you're going to work with. And then you have to propose a pilot project that's technology enabled. It does not have to have an AI or ML component. It just could be emerging technologies and whatnot. And so what we're looking for are companies, and it could be a pre-seed company, it could be a Series D company, it could be a nonprofit research think tank that has $1 billion under funding, it could be the AARP. It just has to be scientifically novel and something that we would like to see commercialized or used in the next 3 years. So we're distinguishing ourselves from some of the other NIH or NIA types of research programs where we're not looking for a pure play academic research project. If you look at our awardees, over half of them were private companies this year. And so we have an accelerator. It's a multidisciplinary team that's actually going to raise them. So we want to encourage everybody to work, and we actually just generally want to empower the space And the ARP thus far has been a great partner, so we thank you for the opportunity. And also, you're all invited on March 8th to our convention, and we have Sarah that will be speaking at Johns Hopkins. So, thank you.
Thank you. Can I have our fabulous leads up here? Because I'd love to ask a couple more questions. Larry, can we have a couple more mics up here?
I've got
okay.
one.
Thank you. So thank you. I wanted to bring you all back because in addition to the prize money and this sort of cohort structure and this outreach, you also are each providing resources to the innovators along their journey. So Stephen, let's start with you because you mentioned Johns Hopkins and UMass and these incredible universities that have deep expertise and PhDs who want to be part of a tech conversation even though they might not be the technologists themselves. So tell us how the collaborations work.
So we're not looking to write a check, right? These are zero equity grants that are 1 year the pilot projects that you can request up to 200,000. And what we provide through one of our 3 research collaboratories are essentially the top leading experts in aging, ADRD. It could be a variety of different expertise in gait management, into delirium, into a variety of different areas. So you have the resources of generally the university, and they all have different resources. So, for example, Johns Hopkins has an 800-seat dementia facility, right? And so we're running these pilot projects where we're actually helping recruit the human subjects for these small little tests that you might be validating a product. We have a sleep lab. One of the universities, Penn, has a AI service. Every awardee gets $10,000 in AWS credits as well too. So it's a multidiscipline team made up of the top computer scientists at these universities, as well as aging, gerontology, geriatrics, as well as business as well too. So.
Yeah, I mean, and that's so crucial because, startups and innovators, right, they have the spark of a great idea through a lived experience, as we heard from Antonia. But how do you surround yourself with those experts that can validate your idea along the stages so that you can knock on the door of all of the big enterprises that are here with your data, your evidence, your scientifically backed evidence. So that's awesome. Thank you, Stephen. Sarah, yeah. You've got access to resources throughout the whole brain health community, and it's such a complex subject. Help us understand the role that, the partnerships that innovators can expect.
Sure. The great example is ARP has lots of resources that we have been collaborating with the Global Council on Brain Health. So we have worked with one of our board members is from the University of Pennsylvania, Jason Karlowish, right? Jason Karlowish, and our chair of the board.
He wrote the book on dementia.
Yeah. So the chair of the Global Council on Brain Health is Marilyn Albert, who's head of the neurology department at Hopkins. So we have gathered the world's greatest experts together to help define what the problem is, and then we translate that into English so that we're bringing older adults, their families, to the table to understand what the problem is and what the solutions might be. So we're bringing the resources of experts all around the world who have the knowledge to share, but not successfully translated that out into everyday life and practice. And so by making these experts available, by sharing this knowledge, and by ARP's incredible megaphone, we have the world's largest circulating magazine, literally the world's largest magazine. And so people are hungry and desperate for this information. So we can provide this megaphone for the solutions and help people meet the solutions and build that customer base so that we are linking the people who need your solutions with your brilliant things that actually work. And I'll just give a pitch here to the Global Council on Brain Health Information. So we have a standard. We want this information to be available to everyone around the world. We say, would a woman in Indonesia who doesn't speak English be able to understand what they're going to be able to do for their brain health? And so we distill these reports after bringing these experts from all over the world together. We do 25-page reports, but how many people are reading 25-page reports, right? So we distill it into one-page picture infographics and make it freely available in multiple languages to people around the world. So it's really about seeding the ideas of what needs to be done, what could be done, how do we bring hope to people, and connecting the solutions with the people who need them.
Love it. So, you're reminding me too of kind of the global call to action that we just all went through as a shared experience with COVID, right? There was like this radical collaboration. Everybody was racing to the vaccine. So, you had scientists and thought leaders and, practitioners all around the world saying, yes, let's share, right? And so dementia is kind of like this call to action that's global. So thank you for bringing those resources together. Antonia, when I think about the corporate environment and innovating within a large corporate, there's a lot of resistance to change, as we know. I mean, it's fine. So help us understand how you support innovators like intrapreneurs, essentially, at Comcast.
Absolutely. So we like to think of the way that we partner with startups and startup founders in two ways. We like to partner and we like to invest. So for a later stage company that has kind of validated what they're working on, they validated their approach, we want to be your partner. We want to pilot it. We want a proof of concept with a goal towards becoming your customer. So that's non-dilutive. It's not equity. It's revenue in the door. It's sales in the door, because we're looking for solutions that solve our problems, and we're buyers in the market like anyone else. For earlier stage companies, often we do invest. We have accelerator programming. There are opportunities sometimes where the investment is not tied up with other programming, but is just investment into those companies. But again, we're looking there to, one, help the founders keep going, but also we always have a strategic partnership in mind of, yes, you're early now, and we have 100,000 employees, and that you may only have a team of 5, so you may not be ready to take on a company of our size now, but how do we help you get there? How do we help you shape and mold and lean on our experts to get there? And so to answer your question around entrepreneurship, how we do that is leaning on our colleagues who are some of the smartest, brightest, world-class experts in what they do. So how do we connect someone who is building an aging in place solution with someone on our team who has actually led all of our innovation and research there? How do we help people skip a few steps by being able to answer those questions immediately? And for our employees and our colleagues, it's incredibly motivating, it's energizing, and it forces folks to think a little bit differently, to have additional new inputs from the marketplace. And we're really proud to be able to be the conduit to that.
Love it. So it's, everybody wants to see themselves in the shared outcome, right? So if you've got this level of expertise, you might not be the innovator per se, but if you're on the team or you've given some advice or mentorship or guidance, it gets very uplifting, right?
Absolutely.
And, I like to say, innovation is another word for optimism, right? When we look at some of the most complex things that we're all
Tweetable.
facing. Tweetable, okay. Hashtag innovation is optimism. So let's just do a quick, because I'm sad to say that we have to wrap up, but let's just do a quick sort of rapid fire. If for an innovator to knock on your door, Stephen, what are you looking for? What's their checklist? What does it need to look like before you're saying, yep, come on in, you're a qualified lead?
These are projects that still have to be reviewed and approved by the NIH. And so we're looking for projects that have validated technology, or a prototype at least. Because if you think about it, this is a 1-year pilot project. And so think of it as a accelerated product sprint where you're researching some sort of novel conclusion or solution. It hopefully contributes to the scientific literature in some capacity, but also hopefully dovetail with your product development as well too. obviously we have a ton of traditional NIH researchers that also are working on very novel solutions. But generally, from my perspective, I'm also looking at some of these startups that are in health tech or med tech that maybe they have an application in a different space, but that want to apply something to this aging or ADRD market and or the dementia market, which is, as you guys know, massive, growing, untapped, and uncontested. So.
Fabulous. Thank you, Stephen. Sarah, somebody's knocking on your door for the Longitude Prize. What are you looking for? What's the checklist?
Is there a technology that will improve a person's quality of life now, today? Is this company going to be able to co-partner with people living with dementia to make their product even better? And are they willing to think about how it will help the caregiver as well as the person living with dementia? But I just want to give a quick shout out. ARP has done so much research, consumer-based research, on what are the barriers for people dealing with these issues. So I just want to put it out there, like whenever the Global Council on Brain Health puts out a report about issues around what actually works to help people, we do these consumer surveys, like what are the barriers? So innovators who are really willing to dig in and understand what consumers want, but also what are the barriers they need to jump over in order to use their products and services. I just want to say we've got so much research out there available for free so that you can really dig in and understand the market better.
Love it. So do your homework, read all of Sarah's reports, right? And take advantage of the vast amount of quality information that's out there. Vetted quality information. Okay, perfect. Love it. Antonia.
Yeah, so I'll echo what Stephen said. We're generally looking for companies that are at least at the pre-seed stage. Typically, that means they are post-product, that minimum viable product is built. In terms of kind of industry sector, we are such a large company, so we have a pretty broad strategic mandate. In care right now, we are actually finalizing 2 deals. One is a pilot, one is an investment. So we look forward to being able to announce those publicly soon. But we also have the mandate to be able to look pretty broadly. So we can look at things like prop tech, like property tech, because we are a company that is physically in people's homes. We can look at health tech. We can look at things like fintech or metaverse, Web3, blockchain, because we have such a broad based business interest. So I would encourage everyone to just visit us online and sign up for our newsletter to get the latest. So our website is lift, L-I-F-T, .comcast.com. I'll give you one more time. It's lift, L-I-F-T.comcast.com, and sign up because we are constantly putting out new calls to the market, and you may be surprised by some of the industries and sectors that we're interested in innovating in.
Well, and like we say here at the AgeTech Collaborative, aging is living. So indeed, solutions can come from any sector to help people live longer and age better. So we've been saying all week here at CES, if you are an innovator who wants to solve problems that matter with the upside potential to change the world, you're in the right room. Because billions of people around the world, including you and your family and your customers, all want to age better. So with that, I'd love to thank Stephen and the A2 Collective, Antonia and Comcast Lift Labs, and Sarah and AARP and the Longitude Prize, and all of your partners, and everybody out there who's creating these structured journeys with prize money and mentorship to help innovators along with the journey. Because together we really are changing the world. Use your perch. Innovation is optimism. And the future of care is the future of work. Yes. All right. Thank you.